In this hospital, Ebola has been diagnosed on British soil for the first time. A female healthcare worker who had travelled to Sierra Leone to help battle the disease is being treated in an isolation unit here in Glasgow by a specialist team.
She was transferred to the Brownlee Centre using a kind of specialist ambulance service and was admitted to ourselves using well-established, well-practised protocols. She herself is quite stable and is not showing any great clinical concern at the minute.
This year, Ebola has ravaged parts of West Africa. The symptoms are diarrhoea and vomiting, as well as weakness, bleeding and fever. It is spread by contact with bodily fluids. There is no known cure, and it is killing 70% of the people it infects. But the authorities in the UK say there's no need to panic.
The risk to other people as a result of this confirmed Ebola case is deemed to be extremely low. Given the early stage of diagnosis, the patient was displaying no symptoms of the kind that would lead to onward transmission and put other people at risk.
The healthcare worker left Sierra Leone yesterday, bound for Casablanca in Morocco. She then boarded a flight to London Heathrow before flying from London to Glasgow, where she arrived at around 11:30. The woman reportedly had contact with just one person in Scotland before being taken into isolation at 7:50 this morning. As soon as the patient contacted the NHS, we're told that a detailed plan was put into action. She was brought here by ambulance in isolation and will now be transferred to a specialist unit at the Royal Free Hospital in London. She is believed to be an NHS employee who was working at a British government facility near the Sierra Leone capital, Freetown.
We're also reviewing our procedures and our protocols for all the other NHS workers who are working at the moment in Sierra Leone, alongside colleagues from the Department for International Development and the Foreign Office. They are doing a very